So what I'm going to do now is take a few pictures of you so we can do some 3D imaging, show you what you're going to look like after. Okay, so hold still for me. These are a selection of the implants. You got silicone implants, saline implants, but more importantly, this is just for you to feel them. I'm going to show you what you're going to look like with the different type of implants inside your body. Okay? So first, we're going to look at assessment. You're actually very symmetrical. Both sides of the breast are very similar to each other. You're petite, so your chest wall is narrower, so we have to choose smaller implants to complement your body. Are you thinking saline or silicone implant?
Silicone.
Why?
Because I think I need a lot of volume and saline can do that for me.
So that's a really good question. Sometimes patients need a lot of volume, in which case the feel of the implant becomes really important. So for you, I am going to, I think, recommend the silicone implant, but I'm going to show you what it's going to look like first. And then we're going to talk about the size. So I want to start with something very moderate, nothing very big. So cleavage, I'm sure, is important. Is that a priority for you?
Definitely.
The best thing about this is the most common reason for patients to have another operation is that they don't go big enough. And this allows us to basically show you that size, in which case you can say, no, that's too big, I'm going to come back a little bit. So that's your before, that's your after. That's going from right now you're an A cup, it pushes you to a full B small C cups. It's a moderate size implant, very natural, nothing big at all. And the view that you see most of the cleavage is here, and of course, when you look yourself down, that'll be your cleavage. And we certainly could go bigger than this, but this is a starting point. This is basically the smallest I would make. Up until this size, you actually can have saline implants because the feel is not as important. Anything bigger than this, which I think you should be a little bit more, we have to talk about silicone implants. So if you take a look on this side, you're going to see the implant got a little bit bigger. You saw that? Mm-hmm. So that's your implant before and after augmentation. So now you have a lot more cleavage. Looks a lot more fuller, more cleavage. Not much upper pole fullness. You don't need a lot of fullness on top. If you want, we could give you that, but we got to go bigger. You want to see that?
Okay.
So what I'm going to do is I'm going to show you 3 scenarios. So whenever I go bigger, I actually use a higher profile implant to keep the narrowness into your chest in mind, because that width in your implant needs to remain constant. Otherwise, the implants become too far to the outside or too far to the middle. Basically, have a uni-groove. You don't want that. So that's a good size implant. All right. So basically, this is you now. This is going to a small to medium size C, and this is going to full C, small D cup. So it's a range of options available. And the best thing about this is you'll be able to take these pictures and give you a log on to be able to take a look at this at home and be able to share it with your loved one and take a look and ponder and see which way you want to go with the different size implants. So small, medium, and large. Yep. Any questions?
Can you see how a textured implant would look with this?
Very good question. Yes, you can. So textured implants are best for patients that have a lower pole here. So what I could do is that instead of this big one, I could change your implant to be a textured, smaller implant so you can see the difference between the two. It's a very good question. So these are similar size implant in terms of volume. This one is smooth round. This is a textured shaped implant. From the front, they look very similar, right? But from the side, as you can see, this is a little bulgier and this is a little more natural in terms of shape. So the anatomy of this implant is a lot more flat on top and round in the bottom as opposed to more fullness on top.
Yeah.
I reserve this kind of implant for patients that have a very short lower pole. You actually have a good lower pole here, so in you, it's not necessary to have this shape unless you really prefer to have this kind of a shape. We can do a smooth round implant through a small little incision in the fold of your breast. So you're going to be with one of my coordinators. They're going to talk to you further. They're going to give you a proposal for what we talked about. We're going to meet at least one more time again. I'd like to review these findings at least one more time and discuss it in more detail, closer to surgery, and then we'll discuss it at that time.
Okay.
All right?
Thank you.
Nice to meet you.